feel that maybe the meds are not really sitting so well with you, like, or so how would you go about having that conversation with your psychiatrist? You know, what do you think are some of the questions that they should ask?
It is so important to advocate for yourself.
Okay.
I think even as clinicians, we're kind of moving away from a paternalistic, like, I tell you to take your medicines, you take your medicines, don't ask any questions, right? And we should be moving away from that, because if someone's not going to take their medications and they're afraid to come and talk to you about the medications or the side effects, then we're just going to lose you in the process of care, right? You're just going to not come, you're going to default to appointments, and then we've just lost not just you, but also a lot of functionality that you've been able to provide for the ecosystem that you're in, right? Your family, your work, right? So we want to make sure that it's not the case. So I think from our end, as clinicians, we want to make sure that we're trying to be very receptive to your feedback.
And there's this new trend also on Instagram, but that's among the medical professionals, the Gen Z slangs.
Oh, yes. Okay, so I've kind of had to kind of pick up a few things there myself. But yeah, I mean, it's great. You need to relate to your clients, right?
Yeah.
So if I'm on like slightly higher pedestal and I'm not trying to understand where you're coming from, you're not going to open up to me. And I think that's where we build a therapeutic alliance, right? So, and that's a very key part of treatment or therapy, which is you need to be able to trust me, right?